All right. Awesome. Well, good morning and welcome everybody. 111 people on and counting. I love our Tuesday mornings. For those of you that are not new here and you've been with us for a while, you know how powerful our Impact Health educational webinars are. And for those of you on here for the very first time, I'm excited for you. You're in for a treat, not just because of what we have our hands on with Impact Health, but we have a really special guest who's going to be sharing a really impactful and personal testimony of how Impact has helped her and a really dear family member of hers. And so with that said, my name is Lauren McQueen. I co-host this Impact webinar every single Tuesday at 11 a.m. Central with my business partner, Mr. Jeff Street, who you'll hear from in a little bit. But we love our Impact calls because we believe what we have our hands on with Impact Health is really disrupting a very broken health insurance industry. I don't think it's any surprise to any 131 people on here that the healthcare industry needs a lot of help, right? And what we have with Impact Health sharing, we believe is the help that many people are looking for. And so little personal story about me. I've been an entrepreneur my entire life, literally since I was 19 years old. And so being a healthy person, I never really had any type of healthcare because it was so expensive as a self-employed individual to get coverage, good coverage. And so I always opted out of it. But about almost 16 months ago now, I learned about Impact Health, just like many of you will today. And I was blown away with what I saw. I believed it was an answer to my prayer. I knew I needed to get, some sort of healthcare coverage. And I'm so happy that I came across Impact Health. I got myself a quote and honestly was a little skeptical at first because I was like, this seems too good to be true. But what I've learned over the last year and a half, the more you learn about Impact, the more good it seems to be. And it's all true. And so, got myself a quote for $148 a month, was blown away with the amount of coverage I got. My husband, he is a VP of a large roofing company, and we've been able to, help so many of his employees, both W-2 and offer this to their 1099 employees and get them great affordable healthcare as well. So I'm very passionate about it, but we're going to dive right in. We're going to open this up for Q&A at the end of this webinar. It's going to be about 45 minutes to an hour or so, but feel free in the chat on here, feel free to type your questions. We'll have people on standby to answer your questions, but chances are if you have a question, other people do too. So at the end of it, feel free. We're going to open this up, like I said, for a Q&A. So let's go ahead and get started. So first things first, I want to show you guys our Facebook group. So we have, sorry about that. Let me get my computer working. All right. We have a Facebook group called the Health Share Crusade Community. Like I said, we believe we are crusading and pioneering the health sharing world right now with Impact Health. And so you do not have to be an Impact member to be in this group. So please feel free to scan the QR code or just simply search Health Share Crusade Community on your Facebook and join the group. We live stream these webinars into that group at least twice a month. We are live streaming this one in there today so that you can go back to that and get the recording. I always get that question, will there be a recording? It's in the Facebook group, as well as amazing testimonials, lots of information, just a great group of people that love what we're doing here. So when we talk about healthcare, the reality is the average individual in America paid $452 a month, and the average family paid just under $1,800 a month for healthcare in 2021. In 2019, 59% of bankruptcies cited medical expenses as a major factor. And so 80% of our country is trying to lower their healthcare costs. I don't really think that's a surprise to anybody on here, but 5% of the population is responsible for 50% or more of the annual healthcare spending costs. Let that sink in. That 5% of the population is responsible for 50% or more of the annual healthcare spending costs. So this just means people are overpaying for their healthcare. And over 100 million Americans are in some form of healthcare debt today. So what are people looking for? They are looking for affordable monthly premiums. If you have health insurance, chances are you've noticed a price increase over the last few years. Chances are it's not going down anytime soon. People are looking for affordable copays, affordable deductibles for per person for the family. Employers, they want to be able to offer healthcare to their employees without breaking the bank, without putting them in a financial strain. And the members want to be able to have the freedom to choose doctors that they want to go to get the best possible care, to choose the facilities that they want to go to as well. And so some of the benefits of health sharing program, there are so many benefits of health sharing. Now, I'll just take a pause here because health sharing has been around for over 40 years. So it is not a new concept whatsoever. Okay. It actually originated in churches 40 years ago, where church members would pay each other's medical bills. Okay. And so that same concept of sharing into a pool and paying each other's medical bills essentially is the same concept that Impact Health Sharing uses. However, a lot of the other health sharing programs, maybe you've heard of, Samaritan Health or Christian Health Ministries or MediShare, they are faith-based. So you do have to prove to be a certain religion in order to take part in being a member of one of those health sharing different programs. But with Impact Health, there is no religion restrictions. You don't have to prove to be a certain religion. It is called the Love Thy Neighbor approach. Anybody can be a member of Impact Health. So lots of the same benefits, but Impact kind of takes it a step further, which we're going to talk about here shortly, of some of the other differences between Impact specifically and other health sharing programs. So low monthly costs. So Impact Health, we are saving individuals, families, small businesses up to 70% per month. And think of Impact as privatized group healthcare. So like I said, we're disrupting the health insurance industry. Think about how powerful Airbnbs were when we were talking about the hotel industry, right? Or Ubers with taxis. That's the same exact thing with Impact Health. And then Impact Health, we negotiate rates for medical and pharmacy services. So basically, we contract with established provider networks and negotiate fair, reasonable, and affordable rates for typical things like a doctor's office visit or a 30-day supply of prescription medication. So you're going to see some phenomenal examples here shortly about how Impact actually manages their billing and goes to bat on behalf of the member, where they take a medical bill and they negotiate the price. On average, they're negotiating prices down by 72% of the original cost of the medical bill. So you're going to see some of those examples here shortly. But why Impact? Solution to the rising cost of healthcare, delivers a modern and affordable alternative to health insurance. It puts the power, the freedom, the control back in paying for healthcare in our hands. And it's open to anyone, like I said, open to anyone who's interested in sharing and saving on their healthcare costs. So let's break down some of the main differences between traditional health insurance and Impact Health. So traditional health insurance, we already said high monthly premiums, right? Chances are, like I said, if you have health insurance, you probably experienced a premium increase over the last few years. And that is just continuing to rise. But with Impact Health, we have never seen a price increase. We are going in the opposite direction. We're helping individuals, families, and small businesses save anywhere from 30 to 70% per month. We also, with Impact Health, never have to worry about having a per person individual deductible. A lot of insurance companies, they do that. Each person in the family, each member has to reach a certain deductible, or they have a large family deductible that's very high. It's a lot of money out of pocket before the insurance company actually starts to cover anything. Well, with Impact Health, we have one combined family deductible. And what that means is all of the medical bills for the whole family goes towards reaching one small deductible as low as just $2,500. That doesn't matter if there's 2 people in the family or 12 people in the family. All those medical bills goes towards reaching that one low deductible. With Impact Health, you never have to worry about making sure a doctor is in your network or being out of your network. When you go to a doctor or a certain facility or to see a certain physician and they're out of your network, with traditional health insurance, that's actually a higher cost for you. It can add up very quickly going to see out-of-network doctors. But with Impact Health, there is no network restrictions. So you can take your Impact card and go see any doctor, go to any facility that you want to, and not have to worry about them being out of your network. What this tells me is if something ever happens, you can go get the best possible care. Just like our special guest on here is going to share with you guys how she got her mom the best possible care and did not have to worry about any of those doctors and facilities being out of network. We have the the lowest prescription pricing in the entire industry, lower copays, lower co-shares, lower provider fees. And then we also offer free 24/7 telemedicine. So I don't know about you guys, but if it's not an emergency, the last place I really want to go is the doctor's office, right? You wait there, that's where everyone else that's sick is there. And so with our telehealth, you can actually submit a ticket online. I've done this before. They literally called me within 5 minutes of submitting that ticket. I had a virtual appointment with a doctor, and the phone call was less than 5 minutes and I was good to go. And that appointment was completely free. It is 24/7 and unlimited for every single member of the family. So I highly advise people to take advantage of that when they can. And then also for those that are establishing their citizenship, if they don't have a social security number, as long as they have an ITIN number and then a legal form of ID from Mexico, Guatemala, Canada, or the US, they're able to become impact members as well. And so I get this question a lot, Lauren, how can anybody be an impact member? Like, who's your target customer? Who are the people that are best fit to be impact members? Well, like I said, anybody can be an impact member. That's why it sounds too good to be true. But our target customer are individuals and families who are overall fairly healthy, those who are currently paying some or all or most of their healthcare costs. And in total, 91 million people fall into these three categories. So it's the majority of people. Non-group companies. So this is companies that have 49 employees or less, those that are self-employed like myself, independent contractors, gig or part-time workers, those that are underinsured, or those with no insurance at all. And so again, anybody can be an impact member. Now, another common question I get is, well, what about pre-existing conditions? Okay, so I'm going to say it again. Doesn't matter what pre-existing condition you have or how long you've had it, anybody can be an impact member. You just have to use discernment if, based on your own pre-existing conditions, if this is a good fit for you or not, okay? So the definition of a pre-existing condition is anything that has shown signs, symptoms, has had testing, diagnosis, or treatment over the last 36 months prior to becoming an impact member. So if I signed up for Impact today, and I broke my leg 4 years ago, that's more than 36 months. And then I re-injure my leg, that's not considered pre-existing. So it doesn't it doesn't consider a pre-existing condition. If I signed up for Impact today and I broke my leg 2 years ago, and then I re-injured my leg, this year, that would be a pre-existing condition because I have not been signs, symptoms, or treatment free for 36 months. Okay. Now, so with a pre-existing condition, remember I talked about how Impact Health, when they receive a medical expense from a hospital, a doctor, anyone, they look at the bill and they negotiate the price. They get what's called fair market value, where they're negotiating the price on average by reducing 72% of someone's medical bill. Okay, so listen to this. When you have a pre-existing condition, those medical bills associated with that pre-existing condition will still get repriced. That is huge, great news for you. They will still get repriced. It's just not going to count towards reaching your family deductible. Okay. So you have to just decide, how often do you go to the doctors? Is this an ongoing, medical condition that you have? Does it require a lot of testing and you have a lot of expenses for that? It might not be the best fit for you. But if you have a pre-existing condition that's pretty controlled and it really, you go to the doctors maybe once or twice a year, and there's not a lot of medical bills that have to do with your pre-existing condition, Impact will be a really, really great fit for you. So we're going to post the guidelines, the Impact Health guidelines in the chat here. Everything that we talk about today is actually in those guidelines. If you, some people I know like to read things and whatnot, and also they talk about the pre-existing conditions. Now, when it comes to high blood pressure and high cholesterol, those are not considered pre-existing for purposes of determining eligibility for future vascular or cardiac events. Okay. So let me just break this down and show you a real life example. So remember I said my husband, we have a lot of his employees on Impact Health, and this was one of his GMs in Colorado. right outside of Denver, where he had blood clots in his legs and went to the hospital. Now, blood clots is a normal thing for this guy. It's a pre-existing condition. It's happened, many times before. So he went to the hospital, and the hospital bill was $5,751. When Impact received that bill from the hospital, they looked at it. They said, this is not fair market value. They negotiated the price with the provider, and they reduced the price from $57.51 to $620. So because this was a pre-existing condition, that $620 did not count towards this gentleman's deductible. If it was not a pre-existing condition, that $620 would go towards his deductible. So hopefully that makes things a little more clear for you. But I am going to get myself out of the way. I'm going to bring up my co-host. I already mentioned him before, you guys. I learn from him every single time. He is on fire when it comes to Impact Health. He's helped probably thousands of people by now have incredible testimonies with Impact, get them on Impact Health. And he's just on a crusade and really just has a vision to share Impact with everyone around the country. And so with that said, I'm going to turn the call over to Regional Vice President Platinum, Mr. Jeff Street.
Well, Lauren, thank you so much, and just excited to be on the call today. This is exciting. You can just see people's hunger to go out and learn about affordable healthcare here in our country. We have over 200 people on today's call, just hungry for the information, just like I was 2 years ago, and just like Lauren was when she first heard about Impact. See, Lauren was one of those 26 million Americans opting out of healthcare because the cost was so high. I was somebody, I'm turning 45 years old in a couple of days, and I've been self-employed literally since I was 21 years old. And for the first few years owning a business, I opted out because of the cost. But then when I started paying for my own healthcare, the prices got really high. Matter of fact, when my wife and I first took a look at Impact for ourselves, for our family, it was able to save us just under $8,000 a year. For us, that was a game changer. But in addition to the savings, the more I learned about Impact, once I started using my Impact membership, I went from like, wow, this is great as far as what it's saving me, to really being passionate about being on a crusade to disrupt what I believe is a very broken healthcare system in our country. How many agree there's a lot of things that are broken about the healthcare system in our country right now? And so we're going to really show you some things today that we believe is going to disrupt that broken industry. But for those of you that are learning about health sharing for the first time today, I've got a couple-minute video that has a little intro from our CEO and founder, Mr. Phil Chrysler. And it's got a good little video that I think will really help you understand what health sharing is all about. And after the video, I'm going to get back on and show you guys pricing. Then I'm going to talk about the member experience, how to use your member card. We've got a member spotlight here today that'll be very powerful, as well as a doctor that's going to talk about, from a physician side, why Impact is so good from a provider standpoint. And then we're going to show you what the member center looks like. So let's watch the video, and I'll be right back to talk about pricing with everybody.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why? We're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing, and certainly with Impact. You can stop overpaying, my friends. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the healthcare they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
Well, I love the fact that we're taking community and technology and putting it together to create something that I believe just works better and feels better than traditional health insurance using a nonprofit approach. But let's talk about how simple it is to get yourself, to get your family, or to get your small business a quote with Impact. See, whoever invited you on the call today, they're a referral partner with Impact Health Sharing. They have their own affiliate link that looks just like what I'm showing you here right now, and they'll send you the link. And all you got to do is put the date of birth of the oldest person in your family in and click on the number of people in your family, 1, 2, or 3 plus, click on Get Quote, and then it'll generate a quote for your family. Now, in every quote that's generated, there's 4 different options in each quote. Now, each option is basically the same exact thing. There's only 2 differences. One is the primary responsibility amount that you choose. Now, when I say primary responsibility amount, that's a health sharing term. Those words are synonymous to combined family deductible. So you'll have 4 different options you can choose for your PRA, for you and for your family. The $2,500, the $5,000, the $7,500, and the $10,000 PRA. Again, that's like a combined family deductible. So each quote is going to have those same 4 options. And then depending on which option you choose for your PRA is going to dictate what your standard rate is each month. Now, standard rate, again, is another health sharing term. Those words are synonymous to what you know as a monthly premium. So you can see the lower the primary responsibility amount that you choose, the higher the standard rate is going to be. The higher the PRA, the lower the standard rate is going to be. So for this particular member, again, 1969 date of birth for the oldest person in the family of 3 plus, if they chose the $2,500 PRA, they'd be paying $628 a month. The $10,000 annual PRA would be $456 a month. Now, regardless of which PRA you choose, you're responsible for that PRA. As Lauren showed, on the way to hitting your PRA, Impact will still advocate for you and reprice your medical bills. Once you hit your PRA, you're now eligible for what's called sharing. Now, in insurance, many times there's an 80-20 split. That means once a member hits their deductible, the insurance company will pay 80%. The member's responsible for 20%. With Impact, it's a 90-10 split, which is great. Where once somebody hits that primary responsibility amount, the community shares in 90% of all eligible medical bills, and the member's only responsible for 10%. That's called a co-share. Now, the max out-of-pocket expense for the whole family combined for that co-share per year is $5,000 a year for the family. If they ever pay $5,000 in that 10% co-share, at that point, Impact's community will share in 100% of the eligible medical bills for that family. So here's the quote for that family. Now let's look at what they were looking at prior to Impact. They had gotten a quote from the Affordable Care Plan with Allied. Now, their quote for Allied came out at $661.17. But as you can see there, that was the employee contribution weekly. See, their Allied quote was $661 a week. The Impact quote was $628 a month. So look at how the Impact quote was less for that family for the month than the Allied quote was for the week. Now, that's a major savings right there, about $1,800 a month in savings for that family. But look at the deductible. You can see on the Allied plan, the family deductible, $4,000. The plan they looked at with it that they chose with Impact was the $2,500 combined family deductible. So not only was the monthly plan significantly less, the deductible was less, and also remember there's no network. our members can go to any provider they want anywhere in the country without ever being liable for an out-of-network penalty fee. Now, let's look at another example. Here's a younger family, 1999 date of birth, family of 2. Remember, same 4 options, the $2,500, the $5,000, the $7,500, and the $10,000 PRA. Again, each one has that 10% co-share. They chose the $398 standard rate for the $2,500 annual PRA for their family. Now let's look at what they were seeing prior to Impact. They were looking at Anthem Blue Cross Blue Shield, and their quote came back at $1,200 a month from Blue Cross. So you can see how with Impact, that's an $802 a month savings, but also look at the deductible. With Anthem, with Blue Cross, their combined family deductible was $7,000 for the year. With Impact, their PRA was $2,500. But look at with Anthem if they go outside of the network. See, this really shows you the power of the fact that there is no network restrictions with Impact. See how if you have Anthem Blue Cross Blue Shield on this particular plan and you go out of the network, now your annual deductible increases to $21,000 a year for your family if you go outside of the network. And that's one thing, again, that's just a great example showing how powerful that no network restriction is with Impact. Now, for folks that are seniors that have Medicare Part A, Part B, we also do have a program available that's secondary to Medicare A and B for seniors, where if they want to opt out of their supplemental plan and choose Impact instead, they can. They have to have Medicare Part A and Part B to qualify for this and have to be at least 65 years old. So for seniors, here's how our program works. There's a $1,000 annual PRA. Impact will share in everything that Medicare Part A and Part B does not share in. So Medicare A and B usually covers 80% of those medical bills for the seniors. The supplemental plan would pick up the rest. So in this case, Impact is secondary to Medicare Part A and Part B. So they will share in anything that Medicare A and B doesn't cover after that member hits their $1,000 annual PRA. Now, the rate for this is going to be based on the member's age. It's going to range from $96 a month to $140 a month for that senior, depending on their date of birth. Now, if the senior also has Medicare Part D, Impact will also share in their prescription plan as well. Now, let's look at the member experience going to the doctor with Impact. And this is something for those of you that have understanding of health sharing previously, this is something I believe is going to blow you away, because Impact was architected to look and feel like traditional insurance from a member experience. Matter of fact, many of you have probably heard of MediShare. MediShare is the largest healthcare sharing entity. They have paved the way for companies like Impact. They've done some incredible things. And the original CEO and president of MediShare, the ones that scaled them from 8,000 to 150,000 members, they were looking to grow that company more. They were looking for that company to be more technology focused, more modern, more contemporary, and they weren't really able to make those breakthroughs that they wanted with the company. So they decided to break off and start their own technology company. And they created a technology platform that's industry leading, best in class, most transparent, got together with the executive team with Impact Health Sharing to launch this technology platform. We were the first health sharing company to launch this best in class, most transparent technology platform that you're going to see here today, that they designed to look and feel like traditional health insurance. So this is the Impact member card. So when somebody goes to the doctor, this is the card that they present when they go to the doctors as an Impact member. Now, each Impact member gets a free annual wellness visit or free physical per member of the family, and they also get a $150 blood work credit. Now, we also have a national agreement with Quest Diagnostic Labs, and in your Impact Member Center, you can just log in. It's called the Grassroots program, and you can actually schedule your blood work through the Grassroots program with Quest. And if you do that, 100% of the recommended annual labs will be reimbursed to you. So if you go through that program and you just use the recommended annual labs, you know that your lab work cost per year is going to be nothing. It's going to be completely reimbursed to you. If you want additional labs done, you can do so. There's a great discount for members. And if you don't want to go through the Quest program, you can go anywhere you want. I actually just scheduled my physical for the end of April. That physical is going to be free. My blood work, I'm just going to get it done while I'm there getting my physical. And I'll have that $150 blood work credit that Impact does when you don't use the Quest program. On top of that, something really big with Impact is we offer 50 outpatient therapy visits per year per member of the family. This includes chiropractic. This includes physical therapy. This includes respiratory therapy. I just spoke at the West Texas Chiropractic Convention this past weekend, my wife and I, because the Texas Chiropractic Association is one of our referral partners, and we were educating their members on how chiropractic and holistic friendly Impact is, and how this is something that's so great for their community. So again, those 50 outpatient therapy visits per year, there's no provider fee or there's no copay collected during those outpatient therapy visits. And it's 50 per year per member of the household. This is huge. Also, 24/7 unlimited free telemedicine, as Lauren talked about earlier on. Now, if somebody goes for an office visit after, not including what I just talked about, the provider fee, which is like a copay, is $50. Urgent care is $75. ER and inpatient is $150. What makes Impact different in this process is Impact invested the money to be in all of the clearinghouses in the country. So they have their own EDI payer ID number. In simple terms, what that means is when you go to the doctors, all they need to do is put Impact's payer ID number into their billing system, and it allows them to bill Impact electronically. Here's why this is such a big deal. Previously in healthcare sharing, most health sharing members would have to go to the doctors and pay up front as a cash pay discount, and then submit their medical bills to their sharing company, and sometimes wait a few months to get reimbursed. And it was a very cumbersome process. Impact is designed for those providers to just bill Impact directly, and Impact is processing and paying bills to their providers as of last month in under 18 business days time. So not only is this tremendous for the members, this is great for the providers because they're getting paid faster using Impact than they are with the insurance companies. And in most cases, they're also getting paid more. We pay on average 140 to 160% of the Medicare rate. So it's very provider friendly. Now, so this is how it's designed and architected to work. Now, I believe in full transparency. Guys, sometimes if somebody goes to a provider, they might say, well, we've never heard of this. We don't recognize this. And sometimes, honestly, somebody's just too lazy to actually type in that payer ID number, that front desk person. So sometimes there will be provider pushback. Hey, I don't know about this. I don't think we take this. There's a provider support line number right on the back of the card that they can call, find out how quickly they get paid, how much they get paid. If they say they're not going to call, sometimes you got to lean your shoulder in a little bit big. No, you got to call because they're going to go out and allow you to bill them, and they'll pay you faster than you get paid with the insurance companies. Now, sometimes they still just won't for whatever reason, or sometimes they'll call and for whatever reason, they still don't want to bill Impact. Now, if this ever occurs, our member can be treated just like a typical health sharing member, where if that ever happens, you can just say, hey, just bill me the cash pay discount, and you can pay. You can submit that medical bill to Impact. If you haven't hit your primary responsibility amount yet, it's just going to get deducted from that PRA. And if you have, they will repay you as the member as quickly as they pay the provider. So no longer is there that cumbersome process that was available in health sharing before, where members were waiting sometimes several months for repayment. So we've got a member spotlight here today that I want to have her share her story. Not only is she an Impact member, she's also a referral partner. And if as you're listening to the information today, you say, you know what, I can get behind this, man, I want to share this with other people. Man, I want to be a part of the crusade to disrupt the broken healthcare system. Get back to the person that invited you on the call at the end of the call to say, I want to learn more about the business opportunity here on how to earn residual income. This is one of our top referral partners, and wait till you hear her story with her mom. And let me tell you, when you have something that touches your heart personally, that goes out and makes a big impact, pun intended, on your family, it becomes very easy to share your story and what it can do for other people. So Chanelle, Burt, thank you so much for being on the call today. And I'd love to turn it over to you to share your story. And I think you're going to actually show some medical bills as well, as far as how Impact reprices the bills for the members. Thanks so much for being on.
Well, thank you so much, Mr. Street, for having me. I love that you and Ms. McLean and Ms. Street host this call every single week to really give people a lot of information when it comes to impact, because yes, I just to tell you guys a little bit of my background, I used to be an electrical engineer, and a little over 17 years ago, I started a part-time business, and it was really to help my mom financially because she's a cosmetologist. She has no retirement. Anytime somebody cancels a hair appointment, she doesn't make any money. And I am her only child. So I decided to start a business to help her out financially. And I can clearly remember when I was having success and I told my mom, I said, you know what, I'm thinking about doing this full time. I'm thinking about walking away from my job. And the number one thing that she said to me was, well, what about your benefits? And I said, well, I'll just pay for my benefits just like you. Well, little did I know that, fast forward, I would be married, have 4 kids, and we will be paying close to $1,600 a month for healthcare. But I also didn't know that my mom, like so many other millions of small business owners, don't have healthcare at all. So, here was an opportunity when I started becoming a referral partner for Impact. I was able to get my mom on the service. And what I also didn't know, that just a few months later, guys, she would be diagnosed with breast cancer. Now, I know the first initial reaction is, oh my gosh, I'm so sorry. But thank God, God is good. She's been doing amazing. But, when she got diagnosed, I was so excited because she had Impact Healthcare. And over a year or so before she was diagnosed, I just so happened to be connected to one of the top 1% doctors in breast imaging that's in DC, but my mom lives in Baltimore. So, the number one thing that I remembered was Impact Health Sharing said that there were no network restrictions. So she could visit any doctor, any facility that she chose. And that's exactly what happened. I called the doctor that I knew. She said, get her into my office right away. We'll take care of her. And just like they were saying, there was some pushback when we went to the facility because they had no idea what Impact was. They were simply saying, well, we don't take this. And I said, well, yes, we do. And they said, well, you don't have enough coverage. I said, yes, we do. And the number one thing that really sold me out to Impact was that they needed to do an MRI for my mom. And the nurses were saying, well, we need to get pre-authorization from the insurance company. And we called Impact. And they said, no, you don't. We don't do that. You don't need pre-authorization with us. If the doctor says her mom needs it, then you do it and you just bill us. And what I found out that day, guys, was from the nurse herself. She said that most insurance companies will not pay for an MRI. So there are women going to get seen for breast cancer today that will not get the proper care that they really need because of the insurance companies and the pre-authorizations that are getting denied for them to get the best care possible. So what I want to do today is I want to go through a typical day that, happens with me and my mom, because my mom has had to go through once a week for 12 weeks of treatment. And then we started once every 3 weeks for treatment. And we had to do that for four times. So I am excited to share that we only have one more treatment to go. And then she's done. So I'm so excited about that. But I'm going to take you guys through a day of what happens, because as we know, when you go to a doctor, you are charged for every little thing, right or right. So I'm going to show you what happens with us. So let me just share this really quick. And so this is what happens, okay? When we go to the doctor, first she has to get her blood drawn from a port, and we get a bill from LabCorp, as you can see at the top, for $157 every single treatment. Well, because we had already met our PRA, one of the best things about Impact is that they've repriced your medical expenses, just like they've been talking about today. And they saved us over $100 for the test, for the blood draw. But as you can see, that was also eligible for sharing, guys. And my responsibility, and I'm going to say because I'm the one that takes care of all of my mom's bills, I only had to pay $5.36. Okay, so that's just the first part. Then she has to get some meds, before her actual treatment. And this is just one medicine, guys, that we were charged $357. And this is from the facility themselves. But after repricing and after sharing, my responsibility was only $94.75. But here's what I really want to show you. Here is one of the big ones, because she has to get her chemo, she has to get meds because of her anxiety, and she was charged over $6,000 for this. But Impact, as you can see, saved over $3,700, and my responsibility was only $289. Now, if you paid attention to this, why I say this is just going through a typical day, because the service dates were all the same, okay? And I'll just kind of backtrack so you can see all the service dates are February 5th. Okay, so this is just literally showing you what really happens during a typical day when my mom and I would go to the doctor for her treatment. And this was every single week for 12 weeks. Okay, so what I did today, I simply pulled out the calculator and I was calculating what the cost would have been had we had no coverage whatsoever. Because remember, just like I said, she had no health care prior to Impact Health Sharing. So this was the total cost just for that particular day. Okay, over $7,000 we were charged. But because of Impact Health Sharing, guys, look at what I ended up paying. $389.66 for that day of treatment for my mom. And so, a lot of, people that are looking at this, they think about, well, what if everything isn't covered? What if I haven't met my PRA yet? What if I have pre-existing conditions, just like Ms. McQueen was talking about? Well, anybody can be on Impact. And even though everything may not be covered, they would still reprice your medical expenses. This is why this is so exciting for so many people, because I even broke it down. Had it not been eligible for sharing, we still would have just had to pay over $3,000 because of the repricing of the medical expenses. And guys, here's another bill. I can show you tons and tons of bills that I have, but here's another one where we had to get treatment and a heart echo where they take, test about your heart to make sure your heart is okay when you're getting these chemo treatments. This shows you that it came in at over $7,000. Impact Health Sharing saved us over $6,000. And after sharing, my responsibility was only $93.49. So, ladies and gentlemen, this Impact Health Sharing, we talk a lot about the savings, but it has truly saved my mom's life, because all I think about is, what if we didn't have Impact? Where would we have been? Like, what would have happened financially? And listen, I was already helping my mom financially, building my business part-time, right? Here we are faced with breast cancer as her only child, and I was going to have to help out financially once again. Now, I am married, I have 4 kids, I'm a travel baseball mom, my in-laws live with us, we have a lot of expenses that happen on a day-to-day, for my family. And for us to have to help out financially for medical expenses today, Impact has been a complete blessing for all of us, myself, my husband, my mom, because my mom, all she thought about was, how am I going to pay for this? The number one thing she thought when she got diagnosed was, one, am I going to die? Right. And because of our faith, I said, listen, everybody's going to die, but breast cancer doesn't have to kill you. Right. And she looked at me and she said, man, you don't look worried. And I said, well, I'm not. Number one, we have faith. And this is not the time where we can, waver on our faith. But number two, we have impact health sharing. So I'm not worried about the expenses whatsoever, because one, you can be under the best care with some of the top doctors in our country today, and we can save a lot of money as well. So I am truly, truly grateful for impact health sharing, guys. This has been a service that we are literally, when we say we are disrupting the healthcare industry, the broken industry that all of us are seeing today, seeing is believing, right? And this is why I like showing the bills that we have been, accruing from the hospital and from LabCorp. It's just been a blessing. The Impact Healthcare, staff has just been fighting for us, because when they didn't think that they could accept it, all they did was say, have them call us. We'll take care of it. When your mom needs to get tested, we'll even find a facility that doesn't even charge as much. So they have really been standing behind us and really fighting for everything so that we could be in a better position for our finances when it comes to our healthcare. So I'm so excited to be on sharing this with each and every one of you. I know some people, when you first see this, you're kind of like thinking, well, wow, this is too good to be true. How are they doing this? We were the exact same way, and I'm just grateful. I log into the back office all the time to see all of the things that are being sent, but more so the prayers. The community is just so amazing, because you get to see everybody praying for each other and everybody really being so thankful for this Impact Health Sharing community. So thank you guys so much for having me on, being able to share. And, in myself and my family, we were paying close to $1,600 a month, guys, but now we only pay $605 a month for all 6 of us. So thank you guys so much for having me on, and I'll turn the call back over to you, Mr. Street.
Well, Chanelle, $1,000 a month in savings for your family, but a lot more importantly, what they've been able to do to go out and help save your mom, who is one of those 26 million Americans that had no healthcare coverage prior to Impact. So thank you for being an amazing referral partner. Thank you for sharing your story. And you guys see how amazing this can be from a member standpoint. But I want to also talk about a physician standpoint. We have Dr. John Witcher on the call here today. Dr. John, if you could maybe just take about 2 or 3 minutes and just share from a provider standpoint why you're so passionate as a provider about really medical freedom and what Impact is doing.
Yeah, thank you, Jeff. Appreciate you. Yeah, so my wife and I, we got involved with this business about 2 months ago, but Impact Health, we've had MediShare for the last 10 or so years. And so we understand health sharing. And, like Jeff mentioned earlier, the CEO of MediShare broke away from MediShare and got with Phil Chrysler, and they've put together this Impact Health. And what we like best about Impact Health, it looks and feels more like insurance, in that you have an insurance card. And so it's not like the reimbursement model. You don't have to necessarily negotiate your prices up front. You give them the card, you flip it over, and it's got the information on there that the doctor or hospital can bill electronically. So that's important. Of course, the savings is tremendous, but in the medical freedom movement, you have a lot of us doctors that are really, we understand what commercial health insurance is. It's unfortunately, it's a broken system. They dictate to doctors how to practice medicine, and Impact Health will never do that. Impact Health, they're going to allow the doctors to practice medicine, to take care of the patients. And so this is just a win-win situation for the medical freedom movement. Patients are going to be able to choose what doctors and hospitals they want to go to, have the cost effectiveness that they're not, it's not, they're going to save 50 to 70%. And so, we're wanting to build this parallel health system in the broken healthcare market. And we believe that Impact Health is going to help us do that.
Well, Dr. John, thank you for your testimonial, and just so powerful, the fact that Impact doesn't dictate how a provider diagnoses and treats their patients. And I know you guys love the fact that you can now get paid from Impact in under 18 business days time on average. And we've gone through a lot of information today. What a powerful call. I'm going to show you guys one last piece, and then I'm just going to open it up for question and answer. You heard a lot of people, Dr. John just talked about it as well, is Impact's back office experience, Impact's member center. And so somebody can go to impacthealthsharing.com, click on member login, and then get into their member center. This is actually my member center right here. And remember, we're a nonprofit. What's amazing is you see people praying for each other in the member center, but also you're notified when your account has been matched to share to another member. And I literally just saw this right before getting on the call. And this almost made me tear up when I saw it, because when I had health insurance, I paid them every month. I never knew where my money went. Well, now as I pay my sharing account, part of what's in my sharing account gets matched to go out and help other families. Now, this particular month, literally just 2 hours ago, my account was matched, and $157 came from mine and 21 other Impact members' accounts to go out and help pay a medical bill of $3,287. But the account that I was matched to was actually a personal friend of mine. The account that I was matched to today was somebody that I personally referred to Impact Health Sharing. Now, his family saved literally over $2,000 a month over what they were paying with Connecticut. But now you can see him using his Impact membership. His wife has been going through some things as well. We recently found out that she is cancer-free. But you can see how this month I was matched to her account and actually help pay her medical bill. So somebody can go out and remain anonymous, or they can send a prayer request. They can send a message. I asked them for permission to share that story, by the way. But here's your sharing center. So you have decentralized reserves. So this is actually your member portal. You can see where all the money moves. See, every member has their own personal Impact sharing account. Right now in my account, there's $1,400 just sitting there. And you can see all the times I've been matched where, money came from my account and went towards different families. And again, I love knowing how the money moves. You can see what percentage stays in the share, what percentage goes to admin fees, what goes towards program fees. You can even see the entire community. Total transparency. You can see what do they have in financial reserves. You can see the membership base. You can see what bills were paid last month. What were the highest shares? 25,000, 22,000. You can see what have they paid over the last 12 months. And something we're so proud of as I wrap things up and get ready for Q&A here. A goal of a good health sharing company is to have 3 to 4 months of financial reserves. Impact has over 12 months of financial reserves at this point. Now, health sharing companies, they don't need to have that much in reserves. So Impact is actively looking for ways where they can spend money to benefit their members. We're getting ready to roll out a holistic wellness program that's going to go out and help members that go out and take care of themselves. We're about to be the first health sharing company to also share in dental and vision. Announcements coming on that very, very soon. And also we have the best wholesale prescription pricing in the industry, which is amazing. You need to go out and get a prescription. You just go to My Pharmacy and Labs, and you can actually search for a prescription on your member center, and it'll compete all the local pharmacies against each other to find what's the best price to go out and get that prescription in your area. So we are blown away with what Impact is doing, and even more excited about what they're about to be doing. But I thank everybody for being on the call today. At this point, I want to be able to just open up the call for about 20 minutes, do Q&A. No question is a bad question. We covered a lot of information today, and between myself and Lauren and Chanelle, we're happy to take any questions that you guys have. Hit the reaction button, raise your hand. And remember, if you want to learn more about being a referral partner and the business opportunity, remember to get back to the person invited you on the call to say, hey, I want to learn more about how I can be part of this movement and earn residual income, referring Impact to individuals, families, and small businesses. So let's keep all the questions to Impact itself as far as how this works for members. Any of the business opportunity questions, make sure you direct those offline, and we'll have other calls to go through that. I see we have Crystal with her hand up. Crystal, if you could unmute, would love to be able to take your question. Thanks for being on.
Thank you. I just have a question, and I know you covered it, but I wanted to make sure. So I am a patient of, everybody knows about Bon Secours, right? So my primary practice is under Bon Secours. So if I go there and they're giving me pushback with not wanting to call and different things like that, can I just say, let me be self-pay, and then I submit my bills and documentations to Impact on the back end if I don't have time to kind of force the hand in the moment?
Yeah, absolutely,
Okay.
Crystal. So again, if you have that provider push back and they're not, doing what they need to do, and unfortunately that is going to happen sometimes. You just say,
Okay.
hey, just charge me, cash pay. Make sure you get your UAB form, or I forget what the name of the other type of receipt is there. I think Lauren knows that information there. But that's just the receipt there that you need to send to Impact in your member center. If you haven't hit your primary responsibility amount yet, they're just going to apply that amount to your PRA. If you have hit your PRA already, then they're going to go out and reimburse you. If you've hit your PRA, but you haven't hit your co-share yet, you're responsible for the 10%. They'll reimburse you for the rest. If you've also hit your co-share, they'll reimburse you for everything. And if it does happen to be your annual wellness visit, your physical, they're going to reimburse you for everything, regardless if it is your physical. So hope that helps.
Jeff, I'll add to that. Number one, the name of that bill that you guys want to ask for is just called a supersized bill, basically. And that way it has all the different codes on it that you need. But other than that, if you're at the hospital, for example, and they're giving you pushback at the hospital, you are not forced to pay anything at the hospital when it comes to paying for your medical bill. So even if they try and get you to even pay as a cash pay member, you do not have to do that. They will just bill you. You can just say, hey, you can just bill me directly, but that you can just call Impact and Impact will call on your behalf. So just for those of you that are kind of nervous going to the hospital, you do not legally have to pay anything at a hospital. They will always just bill you, and then it gives Impact time to call them and work on your behalf.
So I'll just add really quick, because I did not know that we weren't legally having to pay, because when I took my mom, they were giving me a lot of pushback, and they were simply saying that I had to pay up front in order to be seen. So we're at the hospital. We don't know when we can get this appointment again. And so I just went ahead and paid, and all I did was just call Impact, and they did reimburse me. And I'll tell you, when I got the check, I was like, am I supposed to cash this? Like, what is this for? But they were like, yes, because you were not supposed to pay that at the hospital. You guys have already met this. So they just reimbursed me. So I just wanted to kind of piggyback off of that.
And I asked that because I've got a surgery coming up. I just lost my corporate job. So that's why this, when the affiliate invited me to this call, I'm also an entrepreneur. I do not need to put the surgery off, but I was like, I need to get something. We're looking at June. So say, for instance, I'm dealing with the doctor now, preparing for this surgery. I still present them with the information. It works the same way, correct?
Yeah. Now, are you an Impact member already, Crystal?
No, I probably will be signing up within like a day or so.
Awesome. And one thing that's important for everybody to know is Impact, there is no open enrollment. So your coverage begins the first day of the next month. So anybody that signs up before March 31st at 6 p.m. East Coast time, your coverage begins on April 1st. So that is important information for everybody to know. There's a $79 one-time application fee when somebody signs up, and then you pay for that first month. But just to be transparent too, Crystal, just what you're going through, because you're already going through it prior to being an Impact member, it is a pre-existing condition. So those medical bills won't be shared by the community. However, they will still reprice those bills, just like those examples that Chanelle showed you. Just the sharing portion isn't going to happen because it is a pre-existing medical bill. Another thing that's good for people to know is there is pre-notification required for cancer treatment, cardiac procedures, inpatient hospitalizations, non-emergency surgeries, organ tissue transplant services, or maternity. So that's on the back of your Impact card. So just make sure, because that is inpatient treatment, they just let Impact know ahead of time, and they'll even advocate for you and call on your behalf ahead of time. If it's ever an emergency, you don't have to, an emergency procedure that's inpatient, that doesn't apply. But when you know about it ahead of time, just let them know ahead of time, and they'll start to advocate for you, Crystal.
Okay, thank you.
Absolutely. Patty, go ahead. Oh, let's see if we can get Patty unmuted, guys.
Sorry. Can you hear me now?
Yep.
Okay. So I have breast cancer myself, and I choose not to do the normal chemo or radiation. I am going through holistic. Would they provide the same thing for holistic stuff, as in getting a cheaper price on different centers and stuff that a person would go to?
So holistic is in Impact's future, Patty. It's not something that we currently do. Minus chiropractic, we do already share into chiropractic, but at this point, in the near future, they're going to have a program where people that do holistic treatments get reimbursements on their PRA up to a certain amount. But that is something that's more in the future than currently. Now, one thing, Patty, I do want to show you too, because obviously, we want to pray for you as well as a community here. And I want to just make sure that you can talk about your own personal situation there with somebody that is that is an expert. And so whoever invited you onto the call, they do have their own referral partner site. And so first off, this is actually what that site looks like. You can watch a video on Impact, but here is where you would go to actually get a quote for yourself. So somebody put in their date of birth and how many people are in the family, but here you can just submit yourself in as a referral, Patty. Just put your name, email, and phone number. You'll get a text message from Impact within an hour, and then somebody will have a consultation call with you. Just talk more about your personal situation with somebody from Impact directly, just to make sure you got all your T's crossed and your I's dotted. I know it's a personal situation, and so just talk to them, tell them the treatment you have, and I just want to make sure I'm talking to you in general terms, but I want to have them talk to you specifically for you, if that makes sense.
Okay, and would a person like me be able to have MRIs? See, what I do is I go every 6 months and I have an MRI of my breast to make sure if it's growing or not. And
yeah, so they'll price that, for you. Again, that is a pre-existing condition, so it wouldn't be shareable, but that is something that would be, as long as the hospital bills Impact there, that they can reprice for you. Somebody asked me a question in the chat, K&M Essentials. If I make a payment upfront, will Impact still negotiate the price? The answer to that is no. That cash pay discount was already arranged amount, but they'll apply that entire amount to your PRA, or if you've met that, they will repay that. So because you've already paid, they can no longer negotiate the price, but they're not going to negotiate that for you and say, hey, you should have only paid 400, you paid 600, we're only going to give you a credit of 400. They'll give you the credit of whatever it is that you actually paid, K&M. Christina, go ahead. Thanks for being on today. It's not allowing us to unmute you for some. Christine, are you on a second device as well, maybe? Can't find your other device. Just name your other. Oh, here we go. There you go. Oh, hold on. There you go.
You just muted yourself again, Christina.
One more time, Christine. I'm sorry. I'm going to go to Lorraine and, oh no, you're unmuted. Stay unmuted. Don't hit it.
Hi, my question is, do you need to be 18 to get coverage?
No.
If you want to, okay.
Great question. So we have a guardianship program. So where somebody goes to actually enroll as a Impact member. So let me just go back to that affiliate site here. So on the top of the page where it says enroll now, this is where somebody would enroll. And you can see there's 3 different types of plans: a general membership, a guardian membership, and a group membership. So a group would be if your company signed up for Impact, you're now attaching yourself to that business plan. But a guardianship membership would be somebody that is the legal guardian that's over 18. So the price for that junior, or whatever you would call it, would be the same price as if somebody is 18 years old, Christina. But there has to be somebody that just would be financially responsible for it. So that would be their guardian. So they could sign up for that guardianship plan. And whether somebody's 6 years old, 8 years old, or 17 years old, they would pay what somebody would pay that's 18 years old. So just as an example, let's just say that somebody was, I don't know. Oops. And here's how quickly the quotes are too, guys. So so they would pay between $73 a month and $211, Christina, depending on which PRA that they chose. That would be that guardianship plan. So great question. Does that help you? All right, Lorraine, we see you now. Be able to unmute. You're still on mute there, Lorraine. Try one more time, Lorraine.
Perfect. Thank you. There you go. Thank you very much. Thank you very much, Jeff. I certainly appreciate the information. Chanelle, certainly appreciate and pray to see your mom. My question is concerning a person that has not yet met their 2,500 PRA. Any chiropractic, I know we share into chiropractic, but if someone has not met the PRA of 2,500, then they have to at least cover the PRA before chiropractic will be shared into, correct?
Yeah, like I'm a great example. I just made an appointment this morning to go to the chiropractor. Dr. Tice is one of our preferred providers, actually. I'm going to go to see him this coming Monday. I haven't come close to meeting my PRA yet. So just whatever, so I'm just going to pay, and then Impact is going to, and I'm going to submit that bill, and then that's going to go towards my PRA.
Okay, perfect. Thank you. Just wanted to clarify. Thank you.
But there is no copay charge, so there is no extra copay charge. So 100% of what I pay goes towards that PRA. When there's a copay, that amount doesn't go towards your PRA, just whatever the bill is after that copay. So I hope that helps.
It does. It does. Thank you so much.
Yep, and he's a preferred provider with Impact as well. So doctors that are on the call, you can go to Impact's website, become a preferred provider. Remember, they're going to pay you faster than the insurance companies typically do, and also usually more as well. It's really simple to become a preferred provider. You just fill out your information. It usually takes less than a week to become a preferred provider. You can negotiate that, that Medicare rate with the Impact rep that calls you. And I know a lot of times for providers, they're getting crushed by the insurance companies. A lot of times it's taken 8-9 months just to get credentialed. This is literally less than a week on average, and they'll actually negotiate with you based on what you believe fair market value is for your area. So Tony, go ahead. Let me see if I can get you unmuted here, Tony. Try now.
Can you hear me now?
I got you.
Excellent. Thank you. Thank you for hosting today, Melissa and Jeff. This has been fantastic. I met you briefly last week, and I didn't recall your name from last week, but I've seen your videos on YouTube, so that's been great also. I've got several questions, but to keep it brief, it kind of goes together. Do we have any kind of projections for, say, 2024 or a 5-year projection of what the projection is for growth with Impact, or what's the goal with ACN as far as enlisting new members? And are they gearing up? We have Impact a support representative calls from Impact to call on prospective members. Are they gearing up also? Do they outsource like they're outsourcing outsourcing ACN to bring in new members? Are they also outsourcing or they have in-house support?
Yeah, great questions. And first off, for anybody that doesn't know what ACN is, that's actually the marketing company that we're all referral partners with Impact. But a few different things back to your question, Tony. They actually just brought somebody in, former executive with Medishare, and they did a significant training program over the last 30 days. They've actually brought that reference-based repricing program in-house from the company that we were working with previously, AMPS, for Impact to actually do that in-house to actually be more efficient for their members. So they're in the process of training a lot of people there. They have a concierge program that they're going to roll out in the future as well. More trainings underway for that. They're currently having triple-digit growth every single month over where they were the year before that same month. Our projections are, and the goal right now is in the next 5 years to be the largest health sharing company in North America. And with our current rate of growth, If it just stays at a consistent rate of growth of where we've been over the last 18 months since this partnership launched with our marketing partner, within 5 years, we'll be the largest health sharing company in North America.
Really good. Thank you.
That's the goal. Now, even if we go a little short of that, I'm still in.
Can I ask another question?
Yeah, go ahead.
I don't want to run over anybody else's time. Oh, I've seen another hand raised. Can I ask another question?
Go ahead, Tony.
There's I see we're negotiating down prices for healthcare costs.
No.
Would they also negotiate down pharmacy prices? And the reason I say that, I think that's part of the healthcare issue is I've been prescribed medications before where there's definitely alternatives. We didn't have to pay $200, $300, $400 for a medication, and it only cost, say for instance, dermatology for eczema. You need to pay $400 or $500 for some kind of lotion. You get O'Keefe's for $10. Are they negotiating or offering alternatives there?
Yeah, so we have the best pre-negotiated prices in the industry for wholesale prescription pricing. So right on your member center, all you do is you just click on My Pharmacy and Labs, you type in a prescription name, and it'll show you all the different pharmacies in your area. So if there's a prescription you want to give me, Tony, I'll type it in and we'll just search my area where I live and just kind of get an idea what that prescription cost would be. Is there a particular one you want me to look up?
No. I was just curious. We have that from time to time, and they're just, a few of them are so overpriced. I can't even recall the particular eczema. It was for eczema when we had kids with diapers. And so I had eczema. I didn't know what that was. So I was prescribed something. I think it was a $500 prescription, but O'Keefe's, you get it over the counter, it's $10.
Yeah.
But if I were to type in a prescription, they were to say something like, here's some alternatives you could do also. I don't know if they have that or if they negotiate prices down, but even at that, what you're describing here is fantastic.
Yeah, and so it's exactly what you're looking for. So here, I just typed in metformin because it's real common. So you can see a 30-day supply of metformin is $1.60 at the different pharmacies near me. Now, every one of these local pharmacies actually has the same price. It's kind of a bad example, but sometimes, like I've seen one pharmacy be $100 less than another. And so just knowing as a patient, as a member, where to go to get the best pricing, but you can also go from, generic or brand. So you can take the brand and search a generic to see if there's a better price for you, as well. So really great tool. And we're cheaper than GoodRx Gold over 90% of the time, Tony.
And I'll just jump
Excellent.
really quick. I don't have an actual picture of it, but for one of the prescriptions my mom had to get at Walgreens, it was over $100. We knew. And I told her, I said, make sure you give them that impact card. And she sent me a text saying it was only $4. So I don't know the name of it or whatever. I can try to find out for a different call, but I do know that they will negotiate the pricing for prescriptions as well.
Yeah, and
Excellent.
again, those are all pre-negotiated. So when you use your impact card, it already pops up at that discounted price. So you don't have to go back and forth. And also Impact will share in addition to the discounts, they'll share in up to $1,200 of prescription per member, per household as well per year. Well, that actually goes towards your PRA. What for generic, I think like 35, I think it's for brand, maybe it's $35, like isn't shareable, the rest is, or but you can look at the guidelines. I forget the exact number, but a small portion of it is not shareable. The rest of it, is when it's not for a pre-existing condition. So in addition to those discounts, what you pay in your prescription will also go towards your PRA, which again is like your deductible. So we're going to go Larry, then we're going to go to Sharisa, and then let's see here, and then we're going to have to wrap things up. I got a call here in a few minutes myself. So Larry, it was nice meeting you this weekend. Go ahead, my friend. Let's see if we can get you unmuted here. All right, try again.
All right. Can you hear me?
Yes, sir. Larry?
Yes. Can you hear me now?
Gotcha.
Okay. I was just wondering if the lady that spoke about her mom with the cancer, and she said she had like 6 people underneath her insurance. is there an option to add, or do you have to add all 6 people, or she just pays her personal premium and everybody's covered underneath her? How does that work?
I can jump in. So that was 2 different things. So for me and my family, we have a family of 6. And so that was one situation where I was saying that we were paying close to $1,600 a month and now it's $605. But as Mr. Street is showing you, it'll just ask how many family members that you are looking for, and 3 or more, no matter how many it is, it's going to be the same. Now for my mom, she's on a single plan for herself. So that was just 2 separate things, but he's showing you right here.
So Chanelle,
Okay.
just as an example, what's the year, the month and year of the date of birth of the oldest person in your family, AKA Aaron?
8/16/78.
Oops. 8/16/1978, and so 3 plus. So here's their, here's their quote, Larry. So just like Chanelle said, 605 is that $2,500 combined family deductible. Now, let's say one of her children, or even her spouse, let's say somebody had a pre-existing condition and that was significant and needed to remain on the traditional insurance plan.
Mhm.
They can do that. So I'm not sure if that's what you're asking, but again, the price for 3 plus is still the same. So impact can be, could be a secondary for somebody as well. So if one particular family member needs to stay on traditional insurance, but they have something that's a medical bill that's not for that pre-X, they could use their impact card in some of those cases where it's better for them. And it wouldn't be anything extra for them to be on the plan, because it's the same for 6 members of the family as it is for 3. So
Okay.
that's what that looks like. Let's say that same person was just one individual in the family wanting it, only one person. So here's the quote just based on that same date of birth, 130 to 268.
Okay, what if it's a single mother that has 1 child? So would they have to put it under 2?
Yep. So we just
Okay.
click on get quote for 2. So 306 to 479. So the
Okay.
3 options are 1, 2, and 3 plus.
Okay, that answered my question. Thank you.
You're very welcome. Sharisa, I hope I'm saying it right. Sorry. Mrs. McCants.
You actually did say it right. Very good.
Good.
So at the end of the year, you get your 1095 for your traditional insurance showing that you've paid, for your tax reasons. Will we get that for the impact health sharing, showing that we have been paying for healthcare during the year, or something similar to like a traditional?
Yeah, so I'm not an accountant, Teresa, but so I'm just going to tell you what I did personally. I just went to my member center where you can print out your statements, and I just sent that to my accountant, and I deducted my healthcare costs. I own a corporation that pays for mine and my wife's healthcare costs. So we personally just sent that statement to our accountant, and we deducted that as our healthcare costs for the year. So again, I'm not an accountant, so I don't want to give you too much advice, there. So it's a little bit different. You don't get that statement. So that in the mail, you can just print it off your member center, your an outline of what your cost was for the year.
Okay. Okay. So I know that also we were looking like on the videos just to kind of familiarize ourselves, on the ACN website. And it was saying like, if you're eligible and ineligible, I'm assuming that's if it's pre-existing
Yes.
or non-pre-existing. Is that what that kind of means?
Yeah, that and also anything. So definitely read the member guidelines. So even though we are not religious based, we are still based on Christian values. So anything that would be considered opposition to what the Christian faith believes, those are ineligible medical bills. So if you look at the member guidelines, there's eligible for sharing and ineligible for sharing. Most of what is ineligible for sharing would be a pre-existing condition like you talked about, but there are certain things again that aren't necessarily parallel to Christian beliefs that are also not shareable. So just take a look at the guidelines to have that have the full understanding. Is that fair?
That's fair. Appreciate all you guys and your information, doing this every week.
Yeah, and great reminder that we do this every week, and we appreciate Mrs. Burt being on here today as our member spotlight. We're going to keep having different member spotlights each week because there's amazing stories to be shared through the impact community. So I have time for one more. So Tony, if you want to message me offline, you can, but I just want to give Marcos a chance here. Marcos, go ahead.
Hey, first of all, thank you very much. Fantastic information. The training was amazing. Being that you were looking at that website where you can see the cost of prescriptions, would you mind looking for two? I know very many in my community that have issues with diabetes. And being that, you know, it is a pre-existing condition, but as you just mentioned, and it's an eye-opener on how, you know, Impact would still be helping reduce those costs. Now, insulin is very expensive, very, very, very expensive. So something like Lantus or a tablet that I think can go even as high as like $8,000 to $1,000, which is called Jardiance. Would you mind looking up?
Just give me one at a time. Sorry.
Lantus. Lantis, I believe.
Oh, I see Lantus with a U, maybe.
Oh, maybe, yeah, correct.
Lantus and then Lantus Solo Star. Let's try Lantus here. So they've got solution for form. That's like, looks like that's the only option. And then they have dosage, just one option. So $63.84 is the least expensive I see it. One, you guys can see how here one pharmacy is $64.23, and I don't think anybody's going to change which pharmacy based on 50 cents, but you can kind of start seeing again which one gives you the best value. So $63.84 for 100 unit ml.
I know, so I know that it goes for about 1,000. My gosh.
Well, let's, and again, I've got LANTUS, you know, before we get too excited, just make sure I'm searching the right thing for you because I'm not familiar with that prescription. So.
Try Jardiance, Jardiance.
Yeah.
And I'll look up Lantus. Yeah, so it's Lantus Solo Star. You're right. Okay. That's what it is. It's a pen.
So I did regular Lantus. We'll look up Solo Star in a minute. So Jardiance is $598.66.
Still, even at 50%. Oh my gosh.
That's awesome, buddy. And then
that is crazy.
Let's look up Lantus Solo Star for you.
That is crazy.
Again, sometimes it's only going to be a little bit less. Sometimes it makes a big impact, pun intended. So, but again, I love the fact that I can know for sure which pharmacy is going to have it at the best price. So,
yeah, no joke, no pun intended. That's a huge impact. That's
here, look at Lantus Solo Star. So again, quantity. Any idea what the quantity is? Here's one pen. Would it be more than that?
I mean, it just depends on the usage, right? So I believe in a box they come in 5.
Okay. So 5 would be $95.28 would be the cheapest price I can see for 5 pens.
Oh my gosh. That's like going to Mexico and getting medication down in Mexico.
Well, I appreciate that's a great way to end, Marcos. I love seeing those testimonials, and we're seeing so many of them with impact. And guys, look, not every time is it going to be as significant as what Marcos just experienced, but there's a lot of times that it is. So we're on a crusade. We are passionate about what we're doing here. And again, if you want to learn more about the business opportunity, get back to the person that invited you onto the call. And so Todd Eatson asked about insurance requirements, ACA. So we do businesses, Todd, that are 49 employees and less. And when there are 49 employees and less, there is no requirement to offer health insurance to your employees. If it is 50 employees or more, to your point, to be ACA compliant, you have to offer traditional insurance. So that's why when Lauren talked about who our target market is, individuals, families, small businesses, 49 employees and less, that is our target market. So I hope that hope that answers your question there. But God bless everybody. Thank you for being on today's call. We'll be back again next week. And again, for any additional questions, make sure you submit yourself in as a lead on that Impact affiliate site, and you can talk to somebody. I do not work for Impact. I'm a referral partner, like many of those that are on the call, and you could definitely talk to somebody at Impact directly if there's any other personal questions you have. So God bless everybody, and thanks for being on the call. And Todd, the mandate